Hi everyone, Mr. Cookit here. Today I wanted to talk to everyone about something very important and very close to me. I have a dear friend who I have known since we were 5 years old in the first grade. So way over 20 years our friendship has lasted, and she has cystic fibrosis. Um, a lot of people don't know what cystic fibrosis is exactly, but when you do know someone who has it, you definitely know what it is. This can directly affect uh, their nutrition. And I just wanted to make this video for everyone to learn about cystic fibrosis, to understand it and what they have to go through, um, and raise awareness about it. Currently, there is absolutely no cure. Um, and this cannot keep on going. So CF is a autoimmune disease, which means you're born with it, that causes a thick, sticky mucus that builds up in the lungs. This can eventually um, move forward into the digestive tract, and including the pancreas and the intestines and other areas of the body. It is definitely life-threatening, and unfortunately, someone who is 30 is considered old for cystic fibrosis. My friend was basically given a death sentence every couple years since she's been 8 or so. Um, it she's always someone who never cared that she was hooked up to IVs and bags and everything while in school. And these are just things that someone has to go through their entire life, their entire childhood. Um, so millions of people in America actually carry the CF gene, but they're asymptomatic, which means they have no symptoms. So if you're wondering how someone gets it, it's when two people with this gene um, come together and have a child. Um, so about 1 in every 29 white Americans have the CF gene. Scary, right? Um, it's just a very random occurrence for someone to get it. It's usually diagnosed by the age of 2. Um, it can cause delayed growth in infants, um, no bowel movements within the first 2 days of life. Um, a severe constipation from the traveling into the digestive tract. Also, increased gas or bloating, nausea, uh, weight loss, fatigue, uh, constant coughing. Um, for someone who doesn't know someone with CF, you're always asking the person, "Are you okay?" Because it sounds like they're choking on something, but the coughing is very common and actually good because it helps bring up the mucus. They do a lot of they take a lot of medicine, um, nebulizers every morning, possibly oxygen throughout the day. These things help release the mucus from the lungs to allow better breathing. They might lose a part of their lung for a surgery, through a surgery, to get rid of a really congested area. And I mean congested, not just like, oh, I'm sick here, now I have congestion. It's like there's zero oxygen going in or out of that part of the lung. So it's better just remove it than have it um, exacerbate to the rest of that lung. It might cause pancreatitis. Um, and again, there is no treatment for this at all. There's other tests and there are treatments. Um, Obviously, the best is a lung transplant, which you have to be in a very good state of health to get, which is hard to always be in a good state of health with CF because you're always in and out of the hospital. There's infections. there is fevers. There are many other things that go on with CF patients that can affect their health status, and it might last a few days, it might last a few weeks, it might last 1 week. It all depends on the person and the severity of their disease and of whatever's facing them that's making them ill. But these will have an effect on whether they can get a lung transplant or not. A lung transplant would essentially cure CF in the lungs, but it would still be obviously the rest of the digestive system. So I mean, getting it is important. Obviously, the lung transplant to prevent things like coughing up blood, pneumonia, which obviously can still happen after the lung transplant if they go on immunosuppressants to prevent rejection of the transplant. Other complications that occur are related to diabetes, because the pancreas is affected, and that can releases insulin and glucagon into the body that controls your sugars. So if the pancreas is affected, you have pancreatitis, that is going to affect these people and cause a form of diabetes. Intestinal obstruction, gallstones, osteoporosis, malnutrition, and this is where the nutrition part comes in. So malnutrition is a big part of this, because you're not getting enough nutrients in the body. So you're not always, you have a curved appetite. If you're nauseous, you have a curved appetite, you're not going to be eating a lot. So additionally, you need to keep your body strong for any possible infection that might arise. So eating a high protein, high calorie diet is of the utmost importance. Furthermore, the mucus in the digestive system that occurs can help prevent nutrients from crossing the brush border into the body, causing malnutrition. So that's how that's affected. So ways to provide these people who are suffering from CF adequate nutrition is by giving enough protein, like meat, eggs, nuts, beans, high soy. At least 20% of the calories should come from protein. Iron helps fight infections. As I said before, osteoporosis is related to CF, and so calcium obviously is very important, because if these nutrients aren't crossing into the bloodstream, then they need to make sure they get enough of these nutrients to prevent these conditions. Zinc helps fight infection as well, so that's also very important. And salt. So salty foods are really important too. Salt helps break the mucus in the digestive system. CF patients tend to lose some salt in their sweat, especially during hot weather, and during physical activity. So salty sports drinks like Gatorade with electrolytes, which include salt, are also very important. Ways to add protein and fat to the diet are whole milk, whole yogurt, peanut butter to a milkshake. I mean, cheeseburgers, like, the list is endless. My friend always had a salt shaker around when she needed to add more salt to something, because obviously her sense of salt was a lot higher than the average person's. Feel free to ask any further questions about cystic fibrosis that you might have on the site. If you are watching this before the site has been uploaded, you can comment on my YouTube page or my Facebook page. This will be posted on both. And just do your best to understand this rare disease. You may eventually know someone who has it, and we need to raise awareness, education, and funds to prevent more people from suffering from this condition. So keep in mind to eat well, choose well, and always be well.